So, what is postpartum hemorrhage? Postpartum hemorrhage is a significant blood loss, more than greater than or equal to 1,000 milliliters or 1 liter of blood loss, or any loss of blood with signs of hypovolemia within 24 hours of delivery. And why do we care about postpartum hemorrhage? It's one of the leading causes of maternal morbidity and mortality worldwide. In the US, it's responsible for about 12% of maternal death, and globally, it's about 25%. So it can happen with risk factors or without risk factors. What are some of the risk factors of postpartum hemorrhage? So obviously, bleeding during delivery is a risk factor, and then augmented labor, chorioamnionitis, delivering large baby, or fetal macrosomia, maternal anemia, maternal obesity, and multi-fetal gestation, where a patient is pregnant with multiple babies, preeclampsia, primiparity, or having the first baby, and prolonged labor. So what are the complications of postpartum hemorrhage? Complications include anemia, Sheehan syndrome. Sheehan syndrome is a condition where, because of lack of blood supply or because of postpartum hemorrhage, the pituitary kind of gets affected and it gets infarcted. And obviously, if there is blood loss, there could be transfusions and orthostatic hypotension, fatigue, depression, and cardiovascular collapse, and even death. So what can you do to prevent it? So the active management of the third stage of labor is critical. So the most effective prevention is active management after birth. And the key components are, giving this medication, oxytocin, after anterior shoulder delivery, basically after baby's shoulder is delivered, giving oxytocin, a medication that helps contracting the uterus, 10 units through injection, or 5 to 10 units through IV, and then practicing controlled cord traction during delivery, and uterine massage after placenta is delivered. So oxytocin is more effective than other medications, and it has fewer side effects. Avoiding routine episiotomy is also important, because this procedure increases blood loss and risk of anal tears. And the other thing that can be done is by manual uterine compression, a procedure where a fist is inserted through the vagina and you press on the anterior wall of the uterus, whereas with the other hand you press on the posterior part of the uterus through the abdomen to kind of shrink the uterus. And for treatment, if the patient is having bleeding, as far as uterotonics, the medications, you can give oxytocin 20 to 40 units in 1 liter of normal saline, and then give half a liter over 10 minutes, and then the remaining fluid 250 over every hour, or over an hour. And then depending on if the patient has a specific condition, you can add additional uterotonics. If the patient has history of asthma, you want to avoid hemabate or carboprost, and also if they have history of heart disease. So the typical unit is 250 microgram IM, that's given every 15 to 90 minutes for a maximum of 2 milligrams. And the other medication is metrogyne, and the typical dose is 0.2 milligrams IM. This is also given by injection every 2 to 4 hours, and you need to avoid this medication if patient has hypertension. And cytotec can also be given 800 to 1000 microgram rectally. TXA can also be given 1 gram through IV within 3 hours of birth. And if you did all the conservative treatments, medications, and everything, if bleeding continues, you can try uterine balloon tamponade, packing, ligating the blood vessels, embolization, or compression sutures, doing compression sutures, and if everything fails, if postpartum hemorrhage is intractable, as a last resort, hysterectomy is the treatment. As far as massive transfusion protocol is concerned, the current recommendation is to give 1 unit of packed red blood cells and 1 unit of fresh frozen plasma and 1 unit of platelets. So as far as signs, signs and symptoms that will help you recognize postpartum hemorrhage. The first sign is usually tachycardia, increased heart rate, but patient might have orthostatic hypotension, they might have nausea, shortness of breath, difficulty making enough urine, chest pain, and so forth. And so throughout the process, we should always measure cumulative blood loss using calibrated drapes or by weighing pads and sponges and things like that. As far as the main causes of postpartum hemorrhage, the mnemonic or the easy way to remember the 4 causes are the 4 T's: tone, trauma, tissue, and thrombin. So tone, if uterus fails to contract, shrink on its own, so it's uterine atony, which is this is the most common cause for postpartum hemorrhage, up to 70%. And if there's any trauma, if there's any laceration, hematoma, inversion, the uterus basically falls out, and it needs to be kind of pushed back into place. If that happens, if the uterus ruptures, so any trauma can be the cause for postpartum hemorrhage. And if there's any retained product, if there's a piece of placenta remaining, if you remember, invasive placenta, you can have placenta that's superficially embedded into the uterus, or kind of like into the muscle, or through the wall of the placenta. So placenta accreta, increta, or percreta. So if there are those conditions, it can lead to retained product. And then the last one is coagulopathy. If the patient has any, patient could be experiencing disseminated intravascular coagulation, DIC, because of preeclampsia or preeclampsia with severe features. So those, coagulopathies can be the reason for postpartum hemorrhage. So for a patient that is undergoing postpartum hemorrhage and getting treatment, so the aftercare involves, monitoring vitals and watching for bleeding, assessing for symptoms of anemia, make sure patient doesn't have chest pain, shortness of breath, lactation problems, think of Sheehan syndrome, and fatigue and those sort of things. And, debrief the patient, and also, as a staff, postpartum hemorrhage can cause acute stress or PTSD. And using simulation drills, hemorrhage cards to improve readiness, practicing treatment or intervention, in case of emergency, in case of this sort of emergency is important. So the take-home points are postpartum hemorrhage is losing, loss of more than a liter or more of blood, or any loss of blood with symptoms of hypovolemia within 24 hours of delivery. And active management of third stage of labor is the best prevention. Easy way to remember the main causes of postpartum hemorrhage, if you think of the 4 T's: tone, trauma, tissue, and thrombin. And lastly, oxytocin is the first line, and depending on patients, underlying conditions, you can use hemabate or methergin, and additional medications such as prostaglandin agonists, or something like a misoprostol or cytotec or TXA can be added. So the treatment is team-based, and rapid action saves lives. And this wraps the case. Peace.